An implant is an artificial root. It replaces a missing tooth, and it's one of the things that patients love the most out of what we do here. An implant is basically a titanium screw that is in the shape of a root that we insert into the bone. Because it's titanium, it's biocompatible, which means that the body likes it. The bone actually will fuse to the implant. The benefit of that being when a tooth is missing, the bone often goes along with it. The sole purpose of the bone is to house the tooth. Once the tooth is gone, the bone is gone, which is why when people lose teeth, they get that sunken appearance. When you place an implant, you're actually stimulating the bone to remain where it is and to not resorb away. And so it gives people their shape back. It makes them look younger because they're preserving the bone, and it allows them to basically have a tooth where they prior didn't have one. There's a big misconception. People think it's painful, that it's difficult. It's actually quite a simple procedure. When we are placing an implant, the whole point is to preserve the bone structure. Because we're doing that, there's often very little post-operative pain and swelling. And the reason for that is because we're not damaging the bone, we're actually preserving the bone, and we're doing everything in a very controlled, careful manner. The procedure itself to place an implant can be as short as an hour, and then the recovery time is about a day or two. Usually, though, it does come in two sections. The first part of it is to place the implant, and then we wait approximately 4 months for the bone to fuse to the implant, and then we can finish it by restoring it with a crown. Implants can be used in many different areas of the mouth. It can be used in the back part of the mouth to replace back teeth. It can be used in the front part of the mouth to replace front teeth. It can be used to replace a single tooth, two teeth, a whole row of teeth. It can also be used to support dentures. A lot of people who have lived 15, 20 years with dentures that are becoming looser and looser as time goes on, as they lose more and more bone, we can actually secure those dentures in with implants where the denture can either be snapped on and off, or it can actually be permanent so that they don't no longer have a denture. There's many different usages for implants. I feel that not only are the patients getting a wonderful quality of service, but it's something that they can really realistically fit into their budgets and into their schedules.